So who's the service for?
So our service is for women and birthing parents who are experiencing moderate to severe mental health challenges following a perinatal loss. So this loss could have been for any reason, but it must have happened within the last 2 years. So for example, it may be following an early loss of a pregnancy, or maybe reoccurrent miscarriage, or potentially needing to have a compassionate termination for some reason, or after losing a baby following some neonatal support. So we can offer support for any women and birthing parents under those circumstances. Thank you.
And how do people access this service?
So to access the service, we would require a referral from a healthcare professional involved in your care. So for example, this might be your GP, or if you're currently in the perinatal period, you might be working with a community midwife, or perhaps another mental health professional.
And then what happens if you are referred? What can people expect?
So if we get a referral for you, what we will do is we will have a look at the details of that referral and determine whether we feel that we're going to be the best service to offer that support. So our service is particularly for women and birthing parents who are experiencing moderate to severe mental health difficulties because of a perinatal loss, which means sometimes the referrals that come through may not be so suitable for our service, but may be more suitable for our neighbouring services. So for example, our NHS talking therapies. So we would have a discussion about the information that we received, and then we can make a decision about whether to offer a triage or an assessment with ourselves. But one of the things we really recognise is that sometimes we might get a referral where there hasn't been consent, or perhaps parents aren't quite sure about what our service involves. So because we recognise this is such a difficult time, we've decided to use an opt-in. So if we feel that you'd be suitable to offer an assessment or a triage, what we would do is we would send an opt-in via email, which just gives you the opportunity to look at our website, see what we offer, check that you feel ready for that support, and if you do, you can just reply to that email and say you'd like to opt in, and then we would offer you an appointment for either a triage, which is an online 30-minute call, or a full assessment, which is a 90-minute face-to-face appointment.
And once you've taken someone into the service and you're supporting them via the service, what sort of activities, what sort of appointments, what can they expect?
So we're a psychological intervention service, which means that a lot of the work will be psychological intervention being provided by one of the clinical psychologists like myself, but also we have a team of specialist midwives that will be working with us, and they would be able to offer, for example, discussions around the loss of your baby, in case, for example, you wanted to understand a little bit more about what's gone on, or maybe have conversations about if you're wanting to plan a pregnancy in the future, or if you're currently pregnant again, they could offer more enhanced midwifery support, which could see you through antenatal care right the way up until 8 weeks postnatal.
So it's mostly one-to-one, and it's very kind of tailored for that person's
absolutely,
experience.
Yeah, very tailored to the individual. Mainly one-to-one for now. We're hoping in the future we'll be able to run some groups, but as it stands, primarily one-to-one at the moment.
Great, thank you very much.